What's up, y'all? Welcome back to Purple Bear Biology, where we talk about A&P, microbiology, and some other cool topics in biology. If this is your first time to stumble upon my videos, then you should click the subscribe button and look at the other cool topics I have covered. In this video, we are going to focus on discussing the different types of movements that our muscles can perform. The goal is to go over the basic movements so that they can be applied to muscles and groups of muscles. This should also help with learning muscle names. Keep in mind that we will not cover specific muscle names in this video. If you're looking for an introduction to basic muscle names and locations throughout the body, then look in the description section below for a link to another Purple Bear Biology video over that topic. Learning muscle, in my opinion, is a three-step process. The first two steps are learning what movements our bodies can produce and the names of the muscles and their locations. The last step is to understand where a muscle attaches. When you combine all of this information, you get a comprehensive picture of the function of each muscle and the movements it produces. To go over all of these basic movements, I'm going to be using the Complete Anatomy app. If you haven't seen this app before, check the description section for a link to this awesome app and check it out for yourself. It's super cool. Before we get started, remember our golden rule of muscle movement. Muscles can only pull, they cannot push. So if we flex one muscle to produce a movement, we must have an antagonistic muscle to move back to our original position. To highlight this and get started looking at movements, let's begin with two basic movements, flexion and extension. Here we are looking at Carl. Now let's take a closer look at Carl's forearm and arm to get a look at flexion and extension. When I initiate the movement, you can see that the muscles that attach to the anterior side of the upper extremity shorten, and the forearm moves closer to the arm. This is called flexion. Notice that the angle between the forearm and the arm is getting smaller. The opposite movement is called extension, and is what occurs when the forearm moves back to the original position. Notice that the muscles required to perform extension are on the posterior side of the arm to pull it back into anatomical position. The elbow is not the only location where we can achieve flexion. We can see this flexion all over the body. Here it is at the wrist, flexion and extension. At the shoulder, we have flexion and extension. At the knee, we have flexion and extension. At the hip, we have flexion and extension. Flexion and extension. We can even get flexion and extension of the neck. Flexion and extension. Not only can our neck flex and extend, but we can perform a third motion called hyperextension. This hyperextension movement can be seen at the hip and shoulder as well. Can you hyperextend other joints? What about your elbow or your knee? Truth be told, many people have flexibility in both of these joints. After tearing my ACL in Brazilian Jiu-Jitsu, some of my PT focused on getting a small degree of hyperextension back in my joints so that it would not be too rigid during activities like running. I have seen a great deal of flexibility in many of my students, and occasionally you hear a statement about being double jointed. Keep in mind that these individuals do not really have double the amount of joints, just increased flexibility. Often this increased flexibility or hypermobility comes at a sacrifice in stability. But that's kind of a cool conversation for another time. Now that we have those three basic movements out of the way, let's take a look at our next movement set, abduction and adduction. This movement is most obvious at the shoulder and hip. Abduction in these two locations involves moving the limb laterally out away from the body. Adduction is the opposite movement, returning the limb medially. These two movements can also be seen as the fingers abduct or adduct to the body. Abduction is the process of them moving away from the midline, and adduction is them moving back. You can also abduct and adduct your wrist. Abduction, adduction. Abduction, adduction. Can you wiggle your toes? Well, then you can abduct and adduct your toes too. Sometimes students have trouble remembering these two movements and get them flipped. I learned this as when a child is abducted, they are taken away from their parents. However, when you add something, you're putting it together. So adduction adds the limb back together with the body. It's kind of a crazy way to remember it, but I haven't forgotten it or mixed it up since I learned this. Okay, so now let's look at our next set of movements. Here we can see depression and elevation. As the mandible is lowered, Opening the mouth, we see depression. As it returns back to anatomical position, moving superiorly, we have elevation. We can also see elevation and depression inside of our shoulder. Elevation, depression. Elevation, depression. While we're looking at the mandible and the scapula, we can also see two other movements, protraction and retraction. Retraction occurs as we pull the scapula back. Protraction occurs as it pushes forward. Retraction, protraction. Retraction, protraction. With the mandible, we can see protraction and retraction. Protraction as it moves forward, and retraction as the jaw resets itself. Protraction and retraction. The mandible is also another location that we can perform lateral and medial excursion. These movements occur when we move our jaw laterally as if you're grinding your teeth. Now let's move from the mandible and look at two cool movements called circumduction and rotation. Circumduction can occur at the ball and socket joints like the shoulder and the hip. Moving your entire upper or lower extremity in a large circle would be circumduction. Rotation, in contrast, is where the limb stays fixed in place but then spins on a fixed axis. Here we can see rotation of the arm. Here we have rotation at the hip. There is a specialized type of rotation called supination and pronation that can take place in the forearm. Pronation is the process of rotating the forearm so that the knuckles face anteriorly, while supination is rotating them back into anatomical position. Pronation, supination, pronation, supination. Speaking of unique movements, you can perform opposition and reposition with your thumb. The opposable thumb allows us to move it towards the fingers, like an OK sign, and back to anatomical position. Moving your thumb towards your fingers would be opposition, and returning to anatomical position would be reposition. If we move from our upper limb to our lower limb, we can find that at the foot we have two basic movements called inversion and eversion. Eversion occurs when the plantar surface of the foot points out laterally. Inversion occurs when the plantar surface of the foot points medially. We can also perform dorsiflexion and plantar flexion of our foot as well. Pointing the toes towards the sky is called dorsiflexion, and pointing your toes towards the ground like a ballerina on their tippy toes is called plantar flexion. The last two movements are more like body positions. Prone is when your body is lying face down. So if we could imagine this person lying face down on a table, this would be prone. And supine is when you're lying face up. So if we could imagine this individual lying on a table, lying face up. To help get a better idea, here are those movements again in a silly way. Where we can see again, supine is like lying flat on your back, and prone is like lying flat on your belly. Pretty cool, right? So now, in our next video, we are going to apply these movements to different muscle groups. Be sure to subscribe so you don't miss the awesome video where we discuss muscle names, locations, and movements. That's it for this episode of Purple Bear Biology. Thank y'all for visiting, and see y'all next time.